Dr. Mitchell, how's it going, my man?
I'm I'm a little irritable actually.
Oh yeah?
Ethereum is up from $90 to twelve
Oh
hundred
yeah?
dollars, and
Oh yeah?
I was thinking about putting a little bit of change in back in March, and
Uh-huh.
I'm kind of kicking myself up in the pants a little bit here. And then secondary to that, um, somebody sent me a DM on Instagram.
uh,
And I'll bring this public just for fun, and this is totally lighthearted, but so there was a javelina outside the office running across the street. And
okay.
javelinas, if you don't know, it's essentially like a variant of a pig. And
Okay.
so I like to post these little things called office shenanigans. Just have fun in the office,
Yeah.
show day to day in the office, and have some fun. And I said in the video, "That's good looking bacon," as it was like running across the street, you know. And this person DM'd me, and
Oh man.
they were like, "It's so sad to see a doctor like promoting harm against." And I didn't read the comments in entirety, but it was something to the effect of, "It's so sad to see a doctor, uh, you know." animal cruelty and recommending bacon, which is a carcinogen. I was just like, what? I'm just having a little fun here.
Yeah, people I mean
Lighten up
unfortunately,
a little bit.
yeah, people take things way too seriously.
Way too seriously.
Yeah,
Way too seriously. Which is not good for
unfortunately.
your health, by the way, as you know.
Yes, exactly. So, anywho, let's get started with this show because we are on the clock. So I appreciate everybody jumping in here to join us today. And of course, my name is Dr. Seth Gilson. I am the biological dentist, certified yoga teacher, speaker, and personal coach. And this is episode number 22 of the Art of Mindful Medicine. So I thank you for tuning in or watching this whenever you are choosing to watch it. And I have a very special guest today, Dr. William Mitchell. Dr. Mitchell is a naturopathic doctor with a primary interest in rheumatology. He earned his Bachelor of Science in Kinesiology and Health Sciences from Vanguard University of Southern California and his naturopathic doctorate from Southwest College of Naturopathic Medicine in Tempe, Arizona. His focus in rheumatology stems from his interest in immunology and autoimmune disease. His special interests include systemic lupus erythematosus, rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and fibromyalgia. Quite the list right there, my man. Dr. Mitchell is a proponent of a concept called integrative medicine and works alongside rheumatology specialists in Gilbert and Scottsdale, Arizona. So we have a information-filled show for you guys today. I mean, as I don't know if everybody watching this knows what all those conditions are, but they are some pretty heavy hitters on that list that Dr. Mitchell deals with on a daily basis. So, Dr. Mitchell, I really appreciate you coming on here and sharing your knowledge and your love with people, because this is what we're doing on here. So, as you do on a daily basis. And and I always start the interview with gratitude. So, if you could please share with us 3 things that you are grateful for today.
3 things I'm grateful for today. I'll keep it really simple.
Okay.
The car is running, 1. The lights are on in my studio, 2. And my toilet is flushing. Well, I should also add there's food in the refrigerator.
Yeah, right.
That's all we need.
Yeah, the food will include water included with the food,
Oh
but
yeah,
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 good
yeah.
clean water.
Water. You pronounced all of those rheumatic diseases so perfectly. You almost rheumatologist.
One of my good friends growing up, his dad. Well, I don't know if I think he retired at this point, but he was a pretty big time or pretty well known rheumatologist down here in South Florida. So
Awesome,
yeah,
awesome.
so we'll have to talk a little bit more about that another time. But right now I want to talk a little bit about you. So Billy, tell us a little bit about you, your youth, life growing up, where are you from, stuff like that.
So I grew up in a small. Well, I was born in Fountain Valley, California. Mostly grew up in Costa Mesa, and then later Tustin, California. Small town in Orange County. When you think of Orange, you remember that show, The O.C.?
Yeah, yeah.
Commerce Buzz. Tustin was nothing like that. It was just this really small town, and not a lot was happening there.
Hmm.
I lived on the border of Santa Ana and Tustin, so it was kind of a rough, lower socioeconomic status area.
Hmm.
Uh, and I just did what most kids do there. They go to school, they play with their friends in the neighborhood. I was a track athlete for a lot of years,
Nice.
and that was kind of like my big focus: track and field and Pokemon. If you know Pokemon.
Jeez, yeah, I remember all that stuff. I never really got into that whole, I don't know what to call it, but that whole fad or phase. I think that it's still around though.
It's still around,
I think kids. I think my nephew loves that stuff.
and now there's too many to count. It used to
Yeah.
be over 50, and now there's over 500. So yeah, grew up there. Went to high school. Track and field was the focus. Entered my undergrad. And the whole time I was really focused on running and being an elite competitive athlete. And so I was really dedicated to running and getting up day and night to get my workouts in and my miles. I probably have more miles on my legs than some people have on their newer cars. That didn't pan out because of health issues, and
Hmm.
that's partially why I do what I do. My estimation is I'm on the autoimmune spectrum myself.
Hmm.
Uh, my family was the type where you didn't go to the doctor unless you had a knife sticking out of your head or you were bleeding out of every orifice. So, but Raynaud's, pleuritic chest pain, GI issues, a lot of depression, fatigue,
Wow.
unexplained anemia. And so, coupled with my interest in performance and nutrition, kind of a byproduct of being an athlete,
Hmm.
with some things that I focused on to help resolve those issues. And so I was, as my track and field career kind of sizzled out, I met a DC, and I don't know how you feel about chiropractors, but
Oh, I.
I'm a little uneasy about most chiropractors. After the car accident, you go to see them, and there's like this sketchy workup that there's a lot of them doing great things
Hmm.
out there, but I'm just being blunt.
Yeah,
But
no, I understand.
my undergraduate anatomy teacher, Mitchell Hopkins, DC, he treated Ann Abernathy, who they also called Grandma Luge, an older Winter Olympic athlete,
Hmm.
and he was just doing things that were way, way ahead of his time. And she had crashed during an athletic event and had a severe head injury, and she was told by some of the best neurologists around, but they never compete again. And he
Well.
fixed her with little electrodes that he hooked up to her head in a video game, which we now know is biofeedback to
Hmm.
ensure damaged parts of the brain, the undamaged parts of the brain to compensate for the damaged parts of the brain. And rather than focus so much on the anatomy, this guy would teach us much about what we now call functional or naturopathic medicine today. And I would just pick this guy's brain and talk to him for hours. And he was like, "Man, you should become a doctor." And so I was like, "Okay, fine." And he talked to me about naturopathic medical school, and I had these previous interests I was talking about, and one thing led to the next, and now here I am. It was a little bit more of an elongated answer to the question you
No,
asked.
that's fine. That's perfect. But I do want to rewind a little bit on that and first talk about or ask you a question that who was the most influential person in your life growing up?
The most influential person in my life. It was Mitchell Hopkins,
Yeah.
definitely an anatomy teacher. Yeah, he just exuded, and I think there's people we come across in life who just steer you in the path you're supposed to go down. He
Hmm.
just exuded this passion, this care, this nurturing, this love for people and what he did. And I grew up in a rough household, so I didn't have good models for what love was supposed to look like or how relationships were supposed to ensue. But I saw a lot of what I really yearned for through him, and taking advantage of gifts and myself, abilities in myself to live a purposeful and meaningful life. And so Mitchell Hopkins, he was just a really, really cool guy.
Yeah. I mean, did you ever attribute any of the health conditions you're referring to any of those that rough household, as you like to say?
Oh, that's a great question. And as you probably know, and there's publications on this, kiddos who have childhood trauma have a 3 to 4 fold risk of autoimmune disease. And so, I don't know to be certain because, like I said, there was little investigation that was done. And I'm at an age now where it's like, what the heck? And I already know what I need to do for me to keep things under control. But I mean, it's more than plausible to um, assume that the chaotic upbringing may have caused that to express.
I mean, it makes sense to me. I've heard, like you said, there's a lot of research on that, and I've heard several other practitioners talk about trauma, whether it's growing up or toxic relationships, toxic behaviors, things like that. It sounds like how old were you when you had that anatomy teacher? Roughly.
I, I was I was in my early 20s. I'll say
Yeah.
that.
So, I mean, you're definitely relatively young, and I think that's a big factor because, I mean, there's multiple ways someone can go, but someone can go to, like you said, leading a life of purpose and utilizing the avenues that you had, whether through fitness and then that interest in health and anatomy and things like that, and you can mold yourself into that road, or you can go down another road, which is quite the opposite, and be living life as a victim. And of course, I'm sure some of those other conditions would have likely come to fruition a lot more severely, or just come to fruition. Period.
And the victim narrative, I like that you brought that up, is a tough one,
Mm-hmm.
because and I've had nuanced discussions with this with other providers, and we all differ on our neurologic spectrum in terms of, if you didn't know, there's a biologic basis for liberal and conservative thinking,
Mm-hmm.
and how
Yeah,
we treat these sort of things.
absolutely.
So I'm more like in the middle, which is not the most exciting place to be because you don't make much money and nobody pays as much as you. But that's where truth is found. To these complex
I'm right
questions,
with you, man.
it's somewhere in the middle, usually.
Mm-hmm.
And you got some problems that have black and white answers. But um, I was reading a book that the rheumatologist recommended to me called "The Courage to Be Disliked," and it's basically like Adlerian psychology.
Mm-hmm.
And I'm reading through this and I'm like, well, this is a great book until I get to the point where the author, I'm forgetting his name, Japanese author, says something like, or he's alluding to the idea that the etiology doesn't matter so much. And I was like, what? The etiology doesn't matter so much? So if we're going back to like the body mind connection and all this childhood stuff you went through, like the Adlerian idea is you don't focus so much on etiology, you focus on teleology, right?
Mm-hmm.
So dispensing with the victimhood idea and focusing on what you have now, appreciating what you have now, and focusing on where you want to go. But what I do all day is sit down and interview people and talk about etiology. Where did this start? Where did it blow up?
Mm-hmm.
So, there's some nuance here. You don't want to dispense with it entirely, but you don't want to adopt this idea of victimhood in its entirety, and let that run in your operating system as this is who I am and this is the reason for what I have. Rather, you want to look at it as, okay, these things happen to me. I am a victim. I acknowledge that I'm a victim of these circumstances and this environment, and that's okay. There's a path forward.
Mm-hmm.
And the hardest patients for me to treat were kind of like, I'm all over the place here.
No, that's cool. That's fine.
The hardest patients I found to treat are the ones who put the locus of control outside of themselves.
Mm-hmm.
And they focus more on that victim
Yeah,
narrative.
when they give their power away.
Exactly. They
Yeah.
give their power away. So I'm not saying, victimhood is a useless concept, but just be careful with how you apply that narrative to your mind.
Mm-hmm. And don't make it a chronic behavior or thought.
Beautifully, succinctly and beautifully stated.
um, yeah, it's really important. I mean, I was writing down the name of the book, and now it's like, nah, I don't think I'm going to read that one.
You don't need to. You already know
uh,
the concept.
yeah, I mean, I think, of course, being present and focusing where we are now. I mean, that's mindfulness, right? I mean, being present. But in order to understand ourselves better, we should have a good understanding of where we came from and learn from where we came from.
Yes.
And I think there's a huge. I mean, just what's going on in our country right now. I mean, there's a huge problem with not remembering where we've come from and what's happened in the past, and learning from it to be better now. And then being better now is the only way you're going to be better in the future. Because if you're not better now, I mean, what are you creating for the future? So
A mess, essentially.
exactly. So speaking of books, what is your favorite book of all time?
Oh, my favorite book of all time. My favorite book of all time. There's so many of them. And I know you asked. I know you asked me to ask
Uh-huh.
me this question, so I had an answer. But like, just our conversation has just sparked so many other thoughts.
Mm-hmm.
Um, I think my favorite book would have to be um, my favorite book. I can't make up my mind here.
All
To
right.
be
Say what are the two you're thinking of?
The first one that came to mind is Outside of the Pillbox by an MD, Tyler
Mm-hmm.
Vincent. I don't know if he's still practicing in Alaska,
Mm-hmm.
but here's a guy conventionally trained, right? And you and I know about that system and the soldiers it creates and how difficult it makes you to think outside of the box. And here's this guy with this background who, publishes like this Bible. And it's just all of this other stuff that's just not talked about in medicine.
Mm-hmm.
And when I say stuff, non-technical, for the things that are necessary to get somebody healthier, to get somebody healthier, and you and I have talked about them: lifestyle, the people in your life, supplements you need to take, um, getting sleep, getting sunlight, feeling like you have a purpose. It just really blew my mind,
Yeah.
that somebody who was trained and went through that system could still maintain an open mind and
Mm-hmm.
consider things outside of their training. And that's what I try to do for myself. I'm trained as a naturopath, and I subscribe to a lot of those facets that are necessary for good health.
Mm-hmm.
I'm also open to the conventional side and recognizing when there's a need for prednisone or methotrexate or Enbrel or Humira or Cimzia or Xeljanz or whatever the heck else.
Mm-hmm. No, and that's great. That's what I try and do in my practice as well. I mean, I was there. I mean, biological dentistry. Well, first of all, most people don't know what that is. Most dentists don't know what that is, and I discovered it last year doing research like about the things that we're discussing, and I was trained conventionally as a general dentist that like you would meet just about anywhere else, and I think utilizing both disciplines is really, really important because everybody's so unique and different. You're not gonna. I mean, that's one of the reasons why I liked dentistry, is because everybody's so different. I mean, yeah, everybody has teeth, but none of them are the same. I mean, literally none of them. I mean, they identify you by your teeth just like fingerprints. So I mean, it's a really unique um, field, and biological dentistry, which is what incorporates oral health with systemic health, and utilizing the best practices possible that we have nowadays to reduce toxic load and toxic materials that are used and things like that.
Mm-hmm.
And I'm amazed that I think 9 out of 10 dentists have never even heard of it. Not necessarily even know what it is, just don't even know the terminology for it. So
Mm-hmm.
it's really interesting. And like you said, I appreciate people like that have practiced from that conventional area, but still have the ability to have an open mind and see things for how they really are, because that's how we learn and that's how we grow and that's how you help people.
I totally agree. I forget who made this comment, but it just really, really stuck in my mind. And it was like this type of black and white thinking, I think, is stifling like the next phase of human evolution. I would make the argument that like physically, I mean, there's still more to be gained, and you see
Yeah.
people records athletically and this or that. But I think like the next big phase of evolution is in human consciousness, which is an idea that I learned about from Bruce Lipton, which I'm sure you've heard of.
Mm-hmm.
Yeah. And this idea of being unopen and being unable to think about things in a nuanced way, I think is just a parasite that's very pervasive and destructive to our evolution and working together as one big human unit.
Yeah, no, I actually 100% agree with you. I think the one of the next, or one of the largest next evolutionary step is that growth in consciousness.
Mm-hmm. Mm-hmm.
Absolutely. So, um, very cool. I love it. So tell us a little bit about the difference between naturopathic medicine and conventional medicine, and like what you said, you practice is integrative medicine. Where does all that fall in the spectrum of things?
So I'll speak about it within the frame of rheumatology because I think
Mm-hmm.
it'll be easier for everybody to understand. But the way we operate in naturopathic medicine, there's a couple different principles, but I'll break it down for simplicity here. Okay? We give the body what it needs and we remove obstacles to health. Okay? The body what it needs, we remove obstacles to health. In allopathic medicine, they just target what they think is the pathology at the deepest level, which is the immune system. So the way autoimmune disease works, barcode from mom and dad, you have a trigger that is unknown from the environment, infections, toxins, nutrient deficiencies, this or that. That causes immune dysregulation. And then depending on the barcode you got from mom and dad, okay, that immune dysregulation will express as lupus or Hashimoto's or rheumatoid arthritis or psoriatic arthritis or antiphospholipid syndrome or blah, 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 blah. Okay? In conventional medicine, how do they operate? They target the immune system. Prednisone, hydroxychloroquine, methotrexate, sulfasalazine, biologics. In naturopathic medicine, we target what's the trigger? Okay, what set this off? We take a very thorough history. Did you have a fever-like illness before? Did you have gastroenteritis before? Were you an airbrusher for 20 years? Painting? Were you exposed to things? Did you start a relationship that was really toxic? This or that. So that's what we're doing. But naturopaths, some of us, I can't speak for all of us, do both.
Mm-hmm.
Okay? Because sometimes you need medications to get people under control, which I find is often the case for many of these patients who we encounter who are really far gone. They've interacted with several specialists, they're a lost cause, and either they weren't treated appropriately based on the standard of care, or they were neglected. And so, a lot of cases I'll prescribe, but that's not the only thing I'll do unless somebody's disease is so severe that I don't think a lot of there's room to address some of these other things. I mean, we do make some effort there, but I'm kind of rambling on here. In short, that's the big difference, okay? Targeting what is more a superficial pathology versus going at this deeper level and addressing some of these things that we talked about. And that's removing the obstacles. Giving the body what it needs. In part, there's some overlap there. Good relationships, good nutrition, go to bed on time, move your body, practice stress management, be mindful.
Mm-hmm. And I think those are fantastic recommendations. And as we move into mindfulness, because you just mentioned it, what exactly does mindfulness mean to you?
It's an evolving definition for me. Okay, and I used to be a big meditator.
Mm-hmm.
I get up every morning, and this is kind of funny to think about a man waking up with another man. There's an app called Waking Up with Sam Harris.
Mm-hmm. Oh yeah, that's very
I,
much.
I used to use that religiously. I love Sam Harris, by the way. If you
Mm-hmm.
want to learn how to think about things and ask questions and poke and prod until you get nowhere, Sam Harris. And some of his debates with another really deep thinker, Jordan Peterson.
I've watched them all.
Oh my gosh, they
They're
are so
really,
good.
it's
They are
fantastic.
so good. They are so.
I 100% agree with you. I listened to a ton of Jordan Peterson. I've listened to a lot of Sam Harris, and their debates, those part 1 and part 2 debates that they had. I don't remember where they. I think they were in Canada. You got gotta watch it. If you guys don't know this, just go on YouTube. It's free. I mean, it's so powerful.
Such good stuff. And maybe you'll lose them after about 10 minutes of talking, which is often the case for me. But I mean, it's just really neat to see two people sit and calmly have discourse and discuss differences of ideas, which I think is something that's today. So needed today.
100%. I mean, we
Totally.
need it more than ever.
More than ever. I mean, we are so divided as a nation. And that's we talked about that. But so I want to get back to what is mindfulness. I mean, we could just go on tangents all
Yeah.
mindfulness. Um, I mean, it used to be like a structured, regimented practice to me, but
Hmm.
to now mindfulness is just focusing on being present, you know. And there's so many outlets for that, and so I get a lot of my mindfulness just sitting in the room with my patients and being there and leaning in and leaning back and responding in a way to what they're telling me, just being intensely focused on an activity for minutes or hours, but washing dishes, you
Hmm.
know, fixing your bike, something like that that just helps you block out the rest of the world and your monkey brain and our frontal cortex, which is like what's so neat about us. We're the only animal that can drive ourselves to chronic illness with our brain, the
Hmm.
front of, yeah, our brain.
Yeah, which is a fundamental principle that I've learned quite a bit about, and I don't know if you remember or know who not Jordan Peterson, Dr. Joe Dispenza is, and he talks a lot about the mind-body connection and how our thoughts affect our emotions and feelings, and can absolutely and do manifest in our health. So,
Huge. I'm not familiar with the name, but it's a concept that many have talked about.
hmm.
Oh, somebody brought me a little gift here. Thanks, Deanna. So I just got an Aura ring.
Oh, nice.
Heart rate variability. I'm sick of using my little phone and the HRV for training,
Yeah.
and then I have Raynaud's, so my blood flow's not so good
Hmm.
and harder to track during the colder times of the year.
Yeah, for sure. So, and I totally agree with you about mindfulness. I mean, it doesn't have to be sitting down doing an actual meditation with your eyes closed. It could just be focusing on a particular activity where all your attention is given to that activity. And like you said, doing that with patients, I think that should be a staple in medical practice. I mean, what else would you want your practitioner to be focusing on other than you when they're in the room with you?
Yeah, and I don't think it's entirely the fault of the providers in the system, and
Oh no.
I can zoom in a little bit more on rheumatology here, and you and I talked about this briefly over the phone, but there's only 4, 5, 6,000 rheumatologists in the country, depending what stats you look at. They're overburdened, they're overworked. Autoimmune disease, I think, it transcends heart disease and cancer if you lump them all together, and they're doing the best they can, and they're tired, and they're seeing 30, 40 patients a day, and they're human beings like everybody else. And they're thinking about what's for dinner by the time 2 or 3:30 rolls around, and they've seen 3 patients in a row with osteoarthritis, and 2 knee replacements, and that they can do nothing more for but give a little bit of tramadol and keep doing steroid injections that aren't really doing much. So it's a tough situation.
Yeah.
But yeah, it's a predicament, and I don't have a good solution to it.
Hmm. Well, I think that's why you're doing what you do, right? That's why that's why we call it a practice, because we're constantly learning, we're constantly training in a sense, and every once in a while we have those aha moments, and that's when beautiful things happen. So,
Mm-hmm. Yeah, there needs to be more providers outside of the third-party payer system, I think, who can just see a lower load of patients and really get to know their patients, practice that mindfulness with them, and be present. And
hmm.
things are now, it's harder for these clinicians to be present. I wanted to add one more thing about mindfulness. Um, I I think meditation and getting into that to get your feet wet is a really powerful way to start, definitely. And there's these apps out there. Waking Up with Sam Harris, there's Headspace, there's
Hmm.
Calm, whatever you like. But it sets a tone and background for you to carry that forward into whatever your day looks like the rest of the day, and how to integrate what you're doing with that practice of being mindful.
Exactly, and that's what mindfulness. I mean, I agree with you totally. I think starting intentionally and sitting down and having a meditation in the mornings, because that's what I do, because I think that's the time we're most clear. I think I can create the space that I want to and
Mm-hmm.
the time frame that I want, and you start with a minute. Like literally, if it. I mean, I don't know anybody that can't that really, if you really want to, if you can't just sit with your eyes closed for quietly for a minute. I mean, it's
It's a little tough at first, wouldn't you say? I know the very first time I did that, I was so terribly anxious. I was like, "Oh my God, I gotta go take a shower. I gotta go brush my teeth. They're waiting for me at the office."
absolutely the first time I did it. I mean, don't get me wrong. I'm not saying you're going to get into meditation in a minute, but it's starting to slowly train yourself and create those neurological connections. And the first time I did it for a minute, I mean, I don't remember what I was thinking about, but my brain did not stop
Mm-hmm.
for the entire minute. And you just do that for a week. Then next week you add another minute, and you can just build on your practice that way. And I think that's a really great way to start.
Mm-hmm.
Um, so, how would you say that mindful practices impact our health?
Oh my gosh, yeah. If we just go back to that, what we were talking about, and how you've got we've got a big frontal cortex, and we can drive ourselves sick with our mind. And I think there's a really good book on this. I forgot the name of the author. You probably know the book. Why Zebras Don't Get Ulcers.
Oh, I have heard of that book, but I have not
Yeah,
read it. But I have heard of that. Yeah, yeah.
why zebras don't get ulcers. And so we've got our frontal cortex. We can let that run awry. We can exercise our executive function to control some of this monkey brain activity, but that monkey brain activity triggers anxiety, triggers stress hormones. You know about the hypothalamic pituitary adrenal axis.
Hmm.
And what mindfulness does is equip you to be resilient against our own monkey brain. So that HPA axis isn't turning and turning and turning and keeping you from sleeping and dysregulating your hormones. And this causes a background of inflammation that that we have all these other facets of the environment that are like kerosene to pour on that
Hmm.
fire, right? I mean, you go to the gas station and you got 1,200 calories of this or that with tons of sugar that are just enticing and very delicious, and you have all these other stressors, and maybe you're not living in a great your home's newly remodeled and you're exposed. So it just sets the tone for you to be less resilient to a lot of these other stressors in our lives. And being mindful helps decrease that background tone of inflammation and
Absolutely.
development of chronic disease.
Beautiful. And so, some of the practices that you've tried, or do you actually incorporate this into your own practice? Do you have people use mindfulness in treatment?
Do I have them use mindfulness in treatment?
Like,
I kind of go back and forth, and it depends on where the patient's at. Somebody's really sick. They're really inflamed. Their CRP's through the roof. Their rheumatoid factor, CCP, strongly positive. I just need to get them under control, right? There's less things that I want to add, and so I might interview them and feel them out and get a sense of what's most feasible
hmm.
for and I think more important than focusing on this mindfulness aspect, which is exceedingly important, but is exposing yourself to just bad energy. So somebody comes in who's super inflamed, stop watching CNN, stop watching Fox, get off of Facebook, get off of Instagram comparing yourself to all these other people. Establish some boundaries with some of these people in your life who might be stressing you out.
100%.
Let's get you under control. If somebody's cruising, they come in, and we'll talk about the same sort of pathology. They've got rheumatoid arthritis, rheumatoid factor negative, seronegative. Their X-rays don't have erosions. they're kind of already on the path of doing some of these more basic things that they need to do to get them healthy with their nutrition, their stressors, this and that, and they're just looking for that extra 20, 30, 40%, then I might say, hey, let's focus on some mindfulness here. Why don't you download Waking Up with Sam Harris or Calm
Yeah.
or this, or get on YouTube and find some program that you can use. So it's really dependent on the patient. I'm not a protocol-driven guy. I try to sit down and really tailor something to the person in front of me.
Mm-hmm. I completely agree with that methodology. And I again, everybody watching, I really appreciate you guys coming on here and taking your time on a Thursday afternoon or morning to watch this. And if you're not watching it live, I appreciate you as well. But there were a couple of questions, and somebody asked about meditation and mindfulness, and if there's some kind of guideline to how you get the most benefits from it. And honestly, everybody's different. I mean, I've read research that it says 15 minutes every day. 15, I think it was 15 to 20 minutes every day, and over the course of a few months, you can see a difference in people's brain scans and their chemistry and things like that. So if you are building up and starting out, I would try and build up to that goal. But how you get there is going to be very unique for everybody. So just take it slow. Start with a minute. If you need to start with 30 seconds, start with 30 seconds. Do whatever you need to do for you to just reach that point, and just stay with it, because it takes a little bit of time. And like I said, everybody goes through these ups and downs with it. But if you just stay the course, it really does work, and it really does help regulate your overall system, like Billy was just saying. And then there was another question from Holly to you about the AIP diet.
Yes.
What is your opinion on that?
I think it's a really powerful tool, and that's the framework that I start with in a lot of patients with autoimmune disease. Okay. I have patients who are already doing it, so we might do something different. They might be eating a lot of meat, so I might make them more plant-based. I have people coming in who are more plant-based. I might make them eat more meat. Like my baseline question is, what have you been doing, and is it working? Oh, we got to do something different now. So I might eat beans or nuts and seeds or this or that. But let me get a little bit more focused here. If you haven't been doing anything really restrictive or specific, I think it's a good starting point. I have some reservations about patients doing it themselves, because I think they need to be guided through that so that they don't end up causing nutrient deficiencies or causing other problems by virtue of too much carbohydrate restriction or getting too much fat. And especially would be concerned in individuals who have a history of an eating disorder. So that would modify how long I carry out the nutritional approach. But I think it's a good template to look at and discuss with your providers. There's a lot of overlap with the Myers Way, Dr. Amy Myers, Stephen Gundry and his lectin thingamajig or plant paradox, whatever, and the Walls protocol. So I think there's some merit to it. I had a guy come in yesterday. He saw like 4 different rheumatologists, and he's like stiff, and he's walking like this, and he's got his MRI show scattered bone marrow edema, and they're just putting him on NSAIDs. I was like, what the hell? I'm a stupid naturopath, and I can see that this guy's got ankylosing spondylitis. And a lot of I'm bringing up this case because I put him on autoimmune paleo. He came back 5 weeks later, and no bullshit here, no exaggeration, 90% better.
Wow.
I gave him a little bit of steroid in the beginning just to confirm that this was an inflammatory etiology, and usually if it is, they'll respond profoundly to the steroid, and you can have some nuanced discussion about, pain in the back and steroids and mechanical pain versus inflammatory pain. 90% better after 5 weeks. He's been off the steroid for 7-8 days now. And we didn't do I asked him to take some cod liver oil and turmeric. And, those are things that are not really going to move the needle that much in my experience. Make you feel a little bit better. But Yeah, so I've had some patients who profoundly respond to autoimmune paleo, and then I have patients who it doesn't do jack shit in. And I'm scratching my head and I'm just like, how could there just be this disparity in response to something like this? And that's something to take away too, just so you don't hurt yourself with nutrition.
Yeah.
Nutrition is not always relevant at a more specific level in like a specific inflammatory sense with all patients. Yes, everybody should strive to eat more plants. Yes, everybody should strive to avoid industrial seed oils. Yes, everybody should strive to avoid sugars. Eat whole foods, ditch the processed crap. That will generally make most people feel better. But in terms of like the specifics and is there a trigger that's food related perpetuating this, doesn't seem to be the case for every case of autoimmune disease out there.
You took the words right out of my mouth. That's exactly what I was going to say about everybody being, again, unique, and what works for somebody is not necessarily going to work for somebody else. And this is exactly what I was going to say, is that a whole foods plant-based diet is generally the best for the overall population. But
Mm-hmm.
as you said, there's going to be certain people that are just need more of one thing or another, or less of one thing or another. And
Mm-hmm.
that's, like you said, you have to work with a practitioner that knows these things and specializes in these things and knows you, not just some random website or app that tells you about something that is supposed to work. I mean, you are a very special, each and every one of us are a very specialized case when it comes to these types of things. So 100% agree with you. Um, you told us a little bit about what autoimmune disorders are, but how would you say, can you go a little bit deeper into how your approach is unique versus other providers?
Okay. So my approach is very unique because, well, one, I actually care about what the diagnosis is. I shouldn't speak for all naturopaths out there, and the way they train in naturopathic school is the diagnosis is very important, but there's a league of naturopaths out there who say, F the diagnosis. It doesn't matter. Because if we remove obstacles to health and we give the body what it needs, the body's going to get better anyway. Okay? And I can partially sympathize with that view because I see a lot of these men and women on the autoimmune spectrum who run the gauntlet. Okay? And when I say run the gauntlet, I mean they go from provider to provider to provider to provider. They waste a lot of time. They waste a lot of resources, and they're traumatized. They get PTSD from the system and dismissive providers who think they're crazy because these things are incredibly difficult to sort out in the beginning. And so part of me is like, yeah, screw the diagnosis, remove obstacles to health, give the body what it needs. But the other part of me too is like, okay, the nature cure practitioners of old times said the nature cure practitioners of the future are going to have an exceedingly difficult time treating patients with nature cure alone. Why? Our food sucks, our air sucks, our water sucks, family units breaking down, we have more
Mm-hmm.
stressors. The world is a tough place to live in. We're becoming less resilient as a species as we age. And I don't mean to sound bleak or grim, and I pray to God I'm wrong, but that seems to be the case. And some people are so far gone that they need help from medication. And I want to know what the diagnosis is. I want to know what the diagnosis is. One, because if I know what the diagnosis is and you need help from heavier duty medication, I know what to get you faster. I know what to get you faster. The other thing, too, and I don't have a strong sense of all of this yet. I'm still sorting it out as a young clinician in my mind, but I suspect that knowing what the diagnosis is gives us hints to what's going on at a deeper level. Okay? So like when I hear scleroderma, I think more about toxicants. When I hear spondyloarthropathies, I think more of the gut. When I hear lupus, I think more about viruses. These are just working theories I have and some patterns I've seen, but I'm not satisfied until I've seen 1,000 at least for each of these ideas I have. And so I have a long way to go there. But one, it helps us know how to treat you, how to know how the disease could evolve, and two, what's the deeper root cause? Does the diagnosis give us hints at that? And my gut tells me yes.
Yeah, that makes sense to me. I think at the very least, it gives you a starting point. If you're seeing a new patient and they come to you saying, I have psoriasis, and at least part of your differential, you're going to have psoriasis. Like,
Yeah.
it gives you a ground to start on, and then you can go from there.
Mm-hmm.
So, um, continuing on the autoimmune misunderstanding of things, what have you found to be the most misunderstood piece of the autoimmune puzzle?
The most misunderstood piece of the autoimmune puzzle. Oh my gosh. Okay, I have a good answer here. The antibodies. Okay. So let's talk about the ANA, for instance. All right. Somebody's got back pain, they don't feel well, so the PCP orders an ANA, precipitates a rheumatologic consult. Not necessarily a good thing. Okay. The ANA is useless on its own. You know what makes the ANA useful? A history, a
Mm-hmm.
physical exam, and an in-depth history at that. I want to know everything about you from when you came out of the womb up until where you are now. I want
And
to
what
see
is an ANA? Can you tell people what an ANA
that.
is?
That's called the autoimmune test, but I mean there's so much more beyond an ANA, but it's an
Mm-hmm.
anti-nuclear antibody, and we most often think about lupus. And so people see an ANA and they think, "Oh my god, I have lupus." That's not what that means. It means you have a positive ANA, and we need to correlate it to your history and your physical exam findings. Lab tests help us confirm our thoughts. If you don't know anything about the patient, or you sat down with them for 5 minutes and you got a positive ANA, how the hell are you supposed to make sense of that ANA?
Mm-hmm.
And so you got these providers, oh, I got back pain, I got fatigue, let's order an ANA, let's track an ANA. No. The most misunderstood thing is the antibodies. You can have positive antibodies, and that could mean autoimmune disease. You could have a positive ANA, that could mean a dozen different things, okay? You could have a negative ANA, and you could have autoimmune disease or lupus. ANA negative lupus exists. And that's like a big thing. Don't give too much credence to what's on a piece of paper. Give credence to the whole process, the history taking, the physical exam, the drug allergies, supplement allergies, how you've lived your life, your family history, all of these things. You need all of the pieces of the puzzle before you can hang your hat on a specific lab marker.
Exactly. I think it's really important to see the overall umbrella of what's going on. And then once you have all of that information, you can start narrowing your focus onto certain aspects of it.
Mm-hmm.
So, um, how exactly do we diagnose autoimmune disorders today, and how do you think it can be improved?
Oh, man. How do we diagnose them today? Okay. So what ultimately ends up happening is, antibodies are ordered, usually by the quarterback or your PCP, and usually what's ordered is an ANA, a rheumatoid factor, a SED rate, and a CRP. Oh my God, the SED rate's higher. Oh my God, the CRP is higher. Oh my God, one of these antibodies are positive. And then that precipitates a rheumatology consult. And hopefully the quarterback, took a good history and actually found good reason to order those tests. And then they get to the rheumatologist. And then the rheumatologist operates based off of diagnostic criteria, okay, which are not diagnostic, by the way. They're just a guidepost. And this is where it's a big freaking mess. So we have all these bullet points, okay, MD soap brain for lupus, Casper criteria for psoriasis, New York criteria for ankylosing spondylitis, and we use that as a guide. Does the patient check this box, this box, this box, this box? Do they have these antibodies, this or that? Okay. And the problem in rheumatology is some people stick too rigidly to the criteria, and some people don't adhere to the criteria at all, and they have their own ideas, which tends to be like some of us naturopaths and functional medicine providers. Oh, you have autoimmunity. And in a lot of cases, they're right. But really, it's finding this middle ground here. And if you're one of the fortunate ones, or unfortunate, depending on which way you want to look at it, that actually has a pathology that we can extract from tissue, that's kind of our slam dunk. You've got a rash, I can biopsy it with immunofluorescence. We think about Sjogren's, dry eyes, dry mouth. You got a lip biopsy, I can extract that, see lymphocytes. Tissue's the best way, but there's this hodgepodge, this spectrum of ways we go about the diagnosis, from diagnostic criteria to Wild West. Some
Mm-hmm.
people very rigid, some people very liberal. So it's very hard. It's not easy. You have to sit down. You have to spend a lot of time with the patient. You have to learn a lot about the person sitting before you. You got to touch. You got to feel. You got to shine a light in their mouth. You got to look at their lacrimal glands in their eye. You got to pick their nose. That's a joke, but really, it's a very labor-intensive process, which is why which is, in my estimation, why there's so few rheumatologists.
Yeah. No, that definitely makes sense to me. Thank you for that. I think that's really important for people to understand. What would you say are some of the most common naturopathic treatments that you utilize versus some of the more conventional treatments?
The most common one, I usually always start with nutrition because that's low-hanging fruit. It's low cost. We just pull these things out. We reintroduce them. We do an experiment. A lot of the times that works minimally, massively. Other times it doesn't work at all. I do a lot of stool testing, okay? More for specific autoimmune entities, more the spondyloarthropathies. I think I'm onto something there, but maybe I'm just crazy, okay? And from that information, I do a lot of antimicrobial treatments, for which I'm a little bit more allopathic than naturopathic, meaning I use more prescription antifungals and prescription antimicrobials than I do herbal agents. I put a lot of people on basic supplementation. My basic 5 in my book: cod liver oil, magnesium, collagen powder, oh my gosh, adaptogens, and I'm forgetting the other guy, a multivitamin. Did I say a multivitamin?
No, that's 5.
Course first. That's not medical advice, but those are just basic things to have on board, and then we may tailor it depending on what the rest of your history shows. I don't do a lot of depuration or detoxification or as much environmental medicine as I thought I would do. I do a lot of infectious disease type stuff, more for the lupus and Sjogren's patients. Okay. And so I would say more than anything else, it's like out of the box thinking with infectious disease. And, maybe it's a bias that I'll overcome as I grow more gray hair as a physician, but it just makes so much sense to me that in a lot of these cases we're dealing with some kind of bug or something that's dysregulating things.
Yeah, and it acts as another toxin in the body, like you were saying, that it's just something that you're exposed to.
Something I want to get on about with you, though, throw a question back at you, and we talked about it a little bit, is root canals in autoimmune disease. And kind of like the framework and working idea I have in my mind is that this is more relevant for some of the rheumatoid arthritis patients who are CCP positive, but I don't have a lot of experience in interaction with patients who've actually had the root canals taken out, and then we can see how things have changed. I do breast implants and other medical devices, but not root canals.
That's a big subject. We only have a few minutes left, but I will definitely.
First time to ask the question.
I know. I will definitely talk about it, and I mean, we can always jump back on here another time and talk more about these things. Of course,
I got to do one of these with you and pick your brain.
Sounds good. Root canals. So there's a lot of debate about this, and I will say that there's also a lot of research on both sides of this issue. And I have seen clinically this past year several patients who have had root canal teeth removed, whether it's one or several, and symptoms, whether it's hypothyroidism or some other kind of chronic disorder that's unexplained, does either completely resolve or get immensely better. And there's not always an abscess present. It's not always something you can see on an X-ray. Sometimes you can see things on a CT scan. But I think really what it comes down to is that we need to put more energy into doing the research that's necessary to figure these things out. And really, like you were talking about before, and like we need to do in everything else, is come together and really find the best solution and not focus on trying to be right or prove the other one wrong. And I think that's really where we get stuck, because to be perfectly honest, there's a lot of new root canal equipment and treatments and different ways of doing things out there that are far more efficient at cleaning out the inside of the canal. they're not available to the 99% of people. And the endodontist, who's a root canal specialist, 99% of them don't have this equipment. So yeah, maybe there is a great way to do root canals, but how many people actually have access to these things? I've done root canals on people in the past, and you know something? I've seen huge changes. I've seen abscesses completely disappear on x-rays, and people's symptoms go away, and they keep their teeth for years. Like we were talking about, small toxins that build up in the body, we don't know how that's going to manifest, and tying those manifestations back to a root canal is very difficult. Again, we can talk more about this. We just have a few minutes left, but that's basically my take on it. I think for me, if I can afford to do an implant versus doing the root canal, just based off of some of the things that I've seen, that's probably the route I would go. Everybody's different, and not everybody has the availability of the different options either. So
I'm definitely going to have to pick your brain more on that.
Yeah, absolutely.
I think you laid it out pretty clear there. It's a tricky one.
Yes, absolutely. So last question, and like I said, we just have a couple minutes. So in closing, if this were the last time you had ever had to share your thoughts, and you could only share 3 things that people should start implementing in their lives immediately to improve their health, what would they be?
Oh my gosh, that's a really tough question. Well, get started with mindfulness. Whether that's a meditation app, whether that's some lecture you listen to on YouTube, or you go out rock climbing, or you go do yoga, or this or that. Get started with mindfulness. Huge. Catalog the people in your life, okay? And really think about whether or not those relationships are serving you or they're harming you. And we can talk more, when I have you on, we'll talk more about that. But people who aren't serving you, and they're a lot of women on the autoimmune spectrum, hyper empathic, they take on a lot of crap from the world, and that dysregulates your immune system. And the ticket is getting some people out of their life for them, and they can go into remission or reduce their medications. So get started with mindfulness. Catalog the people in your life, determine whether or not they're serving you versus not serving you, and laugh, have some fun. Don't take things too seriously. Don't explode on somebody because they called the javelina bacon running across the street. Life is too short.
Yeah.
Watch some Adam Sandler, Happy Gilmore. It's all
I completely agree.
Fun.
Yeah. Have some fun and smile. Just smile. Even if you don't even want to do it, just do it, because it actually fires the neurons in your brain when you just smile, and then you just constantly do that, and it does make a difference. I promise you. There's a lot of research on it. All right, so again, Billy, thank you so much. Everybody, if you want to learn more from Dr. Mitchell, you can find him on Instagram at Dr. Billy Mitchell. That's at Dr. Billy with 2 L's, Mitchell with 2 L's as well. So are there any other outlets that people can reach out to you on?
That's pretty much it.
Okay.
Instagram, you can email me. There's an email in my Instagram profile. I'm on Facebook, Billy Mitchell. I'm pretty much just active on Instagram. I'm a simple man.
And ditto. Keep it simple, right?
That's why I like you. You're a simple man.
Exactly. So everybody, again, thank you so much for watching. Again, whether you're watching this live or not, I really appreciate you taking your time to be with us, and hopefully we were able to teach you something and improve your life somehow. And of course, I always welcome comments, feedback, and suggestions. They're always welcome. You can DM me anytime. You can also check out all of my previous episodes on my YouTube channel, The Art of Mindful Medicine, or on my website, www.mindful.doctor. And of course, we are here live on Instagram. I will be back next Thursday to finish up an interview with Dr. Jill Krista. So please check that out. And I will always put a post out to remind everybody of the new episodes coming out. And as always, I like to end with a quote. And this is from, again, for you, Billy, Dr. Joe Dispenza. Go check him out. He's got a bunch of books out there. He's got some really cool information on the mind-body connection. And you guys are very welcome. Thank you guys so much for watching. And this is the quote from Dr. Joe Dispenza. The inner event is an experience. Experience enriches the brain. We don't see things how they are, we see things how we are. So that's definitely something to think about. I thought those words were very powerful and extremely true. So thank you guys all again. Billy, thank you again. Have an awesome rest of your day. Really appreciate you coming on here, my man.
Seth, it was a lot of fun. Be safe, man.
Absolutely. You too. And remember, everybody, stay awesome, stay mindful. Have a good one, guys.
Bye, everyone.